Hi, I'm Mark Paller, co-founder and CEO of Insurgent Technologies Incorporated. Today, we're going to look at practitioners and the problems that they face in terms of being able to deliver the quality care they believe that their patients need. Practitioners are in a very difficult position in terms of being able to help their patients. The reason is they're really caught in a vice. The vice that they're caught in is trying to deliver what the patients need, at the same time trying also to live up to all of the regulations that the federal, state, local departments of health, or in the case of the federal government, you've got the National Institutes of Health, you've got the CDC, you have, of course, Health and Human Resources, you have FDA, and all of these, of course, have regulations and protocols that need to be followed. Okay? Especially if you're talking about Medicare, Medicaid, and all those things as well. So the practitioner is sort of caught up with all of this bureaucracy on one side, and of course on the other side is the patient. So ultimately, when the practitioner wants to be able to help a patient, first of all, he's got something called a protocol he needs to follow. These protocols can be established by, again, departments of health. It can be established by hospitals. It can be established by a number of different entities. Now, before we go any further, so that I don't have to repeat all of these things I just talked about in terms of federal, state, local, and all of these other governing bodies and regulators, we're going to do what a number of practitioners have done, is lump them all into something that we'll call the healthcare industrial complex. They set the framework with how everything is supposed to work, okay, for the practitioner. The practitioner has to follow their guidelines, follow their protocols. So here a patient comes in, and of course the practitioner runs some tests, and the tests come up, in a way that, that there might be a problem, or there is a problem. The practitioner is required then to make a recommendation of some type of medication to the patient. Okay. Now, that doesn't mean the patient actually accept the recommendation, but inside the chart that the practitioner is keeping, he's got to put in there that he actually recommended this, that this is what needs to happen to help the patient. Okay. Now, as we learned in the previous video, the fact is there is a trust issue between the patient and, of course, the practitioner. And the reason is because of the lack of communication, the lack of interaction between the two, right? So this is a big problem for practitioners. A lot of them are very unhappy with the fact that current healthcare systems don't allow them to build up the relationship that they really need to make sure that the patient gains the trust of, and the practitioner gains the trust also of the patient, so they can really provide the care. One of the things that, in terms of studies, has shown that 80% of patients do not provide the practitioner with all of their health issues. So that leaves, of course, the practitioner a little bit in the dark about what's going on with this particular patient. Also, of course, as we from a previous video, when you go in to visit with the practitioner, you got to fill out all of this stuff about possibly your family history, all the supplements, all the medications. Well, quite frankly, a lot of people can't remember all of them, their names or whatever, how much they're taking. They don't remember them all. They do the best they can to fill in the forms, and they don't like doing it, so they're going to do it as fast as they can, okay, and then turn it in. So that means, of course, that the practitioner is probably not dealing with all of the information they need to in order to make sure whatever it is they need to do for the patient is going to be a positive experience, okay? Because they just don't have enough information from the patient itself. Okay, so with all of this being said, the practitioner does its best to deliver the service to the patient, okay? But a lot of practitioners are not happy with the healthcare systems. That's a whole nother problem. Why? Because They're making it more difficult to get reimbursed. They're making it more difficult in terms of what they can and can't do for the patient. Okay, so practitioners are, of course, unhappy. And the biggest unhappiness they have, which is a study just came out a few weeks ago from Yale University, making it clear the one thing that the practitioners hate to have to use is this thing called EHR and EMR. EHR and EMR are the software platforms that require the practitioner to spend anywhere from 60 to 70% of their time filling out all of these forms about what they're doing with the patient, all of the details of the patient and everything else along those lines, okay? Now, what you need to understand is that means time is being taken away from the interaction of the practitioner with the patient, okay? And thereby, of course, making the patient feel more alienated than they really need to be. So why is this EHR, EMR so important? It's important because the healthcare industry wants costs tracked, okay? This is the important thing to understand. EHR and EMR does nothing to really help the patient in any way. What it's there for is specifically to track costs to help lower the risks of overcharging, of things costing too much for the healthcare, companies, okay? So they insist upon it, and to incent the practitioners, they basically say, well, look, if you use these things, then you'll receive a bigger reimbursement, okay? And of course, with all of the additional costs going on for the practitioners, being able to have, okay, additional reimbursements come in is important, okay? Now, one of the things that most practitioners are forced to do is they don't have these giant labs in order to run diagnostic tests, so they have to basically have outside or third-party labs handle all of the testing that needs to be done, which means they've got, of course, give away some of the money they could be making by having these third-party labs do the work for them, okay? Now, in the case of our EasyMed platform, we're trying to help the practitioner in a number of ways. First of all, we want to make it easy for the practitioner to be able to get a real history, a full history of that patient through the app, which he, of course, can examine it once that person becomes a patient of theirs. And they can see all sorts of information about drugs, supplements, other treatments they have had, all sorts of other things. So they have a much clearer picture instead of forcing the patient to write down all the time, okay, so what did you do? And they can't remember it, okay? Number two, instead of having to send blood tests or other types of diagnostics out to a third-party lab, we give them the ability to perform those tests in their office with very simple diagnostics, okay? And we even go ahead and give them a free analyzer to make it really easy for them to be able to perform those tests and thereby being able to recoup the costs, okay? And now they have a new revenue stream to help them in terms of their practice and growing it and expanding it and so forth, okay? And then, of course, what we do is we provide an AI that can help them with the personalization, because now they'll be able to look at this patient instead of as this generic human being, as a individual, and be able to treat them with the personalization that they really need to have. So as you look at what our platform tries its best to help people in the self-help area, the self-care area, as well as practitioners, because both of them are needed. That means also we try to find ways of helping with the interaction, helping with lots of other things to make the practitioner's job easier for them to perform, and to make sure they're actually providing the type of care they would like to and building the kind of relationship they want with the patient. Now, today, of course, like never before, with all of the problems going on in healthcare, this is vital, okay? Because if there isn't a good relationship between and trust between the practitioner and the patient, that's generally where things start to go wrong. One doesn't trust the other, and all of a sudden, problems occur. This needs to be dealt with. And of course, it's not being dealt with. And I've already explained in our last video why that's the case. No reason for anybody to sit there to try to, find ways of dealing with this. Nobody actually is, okay? Instead, let's go looking for more expensive therapies, more expensive this, more expensive that. But it's the core basic things that need improvement if you actually want to help improve people's health. And it does start with the relationship between the practitioner and the patient, okay? Not with some far off, molecular diagnostic, costing thousands of dollars. It starts off with, being able to trust the practitioner and giving the practitioner the tools they need in order to better service their customers, okay, which of course are patients. That's what we're trying to deliver for them. My name is Mark Powler. You can reach us at www.insurgenttech.com. 1T, please, in Insurgent Tech. And thank you very much for listening.